Hello and welcome to the programme. I'm Takumbo Salako. Well, 1 million cases globally and most of them here in Europe. Let's have a look at the latest figures coming from the Johns Hopkins University in the United States, and we can see it's not a pretty picture at all. COVID-19 has devastated businesses, governments and most importantly families all over the world. It's claimed more than 50,000 lives now. This pandemic, of course, which began here in China 4 months ago and has swept across the world, touching every continent, forcing billions into lockdown. Now, the United States is the epicenter of this pandemic. It's the country, of course, where it's the worst infected country in the world, and health experts say the worst is yet to come. The White House expects up to 240,000 people to die of COVID-19 in the coming months if the containment measures go according to plan, of course. If they don't, the death toll could be in the millions. Face masks are now being used by people to protect themselves from the virus, but opinion remains divided, though, on their effectiveness. The World Health Organization, until now, has recommended masks only be used by sick people and health workers. But some Asian countries say they help prevent the spread of the virus, especially people infected with COVID-19 who may not show any symptoms. Well, we'll be focusing on three main issues tonight. A trio of experts are joining us here to answer all of your burning questions. Joining us from London to talk about health is Dr. Jenny Vaughan. She's a consultant physician representing the Doctors Association in the United Kingdom and all of its members who are on the front lines in British hospitals. We'll also be talking online safety, where this pandemic, of course, has generated a flood of rising crimes as well as misinformation that we've been tackling here. Lisa Forte is here to tell you how to avoid it. She's a partner at Red Goat Cybersecurity in Bristol. And finally, we'll be talking about education too and how families are adapting to a curriculum change it seems nobody saw coming. Samantha Rakati-Joyce is a secondary school teacher and she's working with students in La Brelle, that's close to here in Lyon in France. Well, let me begin by asking a question to you, Dr. Jenny Vaughan. The World Health Organization has been reviewing its face mask, its issues, reviewing its advice on face masks. What do you think of whether they should be worn?
I think it's a good idea. I think the worry at the beginning was we didn't have clear advice, but the lessons, it seems, from Southeast Asia, China, are that actually masks can be helpful. Initially, people were told to wear them if they were symptomatic. But the more we're beginning to understand about this, the more actually the advice seems to be that it may be safer for everyone to wear a mask because this is a droplet spread disease. We know the droplets can hang in the air. There have even been studies showing that if you talk loudly, more droplets can be spread in the air and they can hang around for at least 3 hours. I actually think it's very sensible advice, and certainly in hospitals where it's very hard to do social distancing, where you're looking after patients, I think it's very sensible that our advice has changed and that actually more people are being advised to wear masks in any patient areas and even non-clinical areas where they may come across anyone with the virus, because of course we know that this virus has what we call an asymptomatic period, where people may not be displaying symptoms but actually they are infectious. And so if you come across one of those people, or you are one of those people, you don't want to be spreading that to other people. So I think it's looking like very sensible advice.
Now, it's not your area of expertise. I'm talking to you, Lisa Forte, of course, but it is a security issue. What are your thoughts over face masks?
Well, for instance, from a scam perspective, we have actually seen cases where companies have spent hundreds of thousands of euros actually purchasing masks from companies that claim they have them, and then the masks don't show up. And so this need for masks actually generates a little bit of a risk here for scammers to start, selling fake PPE and similar equipment.
OK, let me turn to you now, Samantha Rakati-Joyce, secondary school teacher here in Lyon. Do you think face masks are something that should be worn? Do you feel more comfortable wearing one when you go out to do your shopping?
Well, to start with, I didn't wear them at all, but the last couple of days I have been, because we've been getting more and more reports about wearing them. So I've decided that it's possibly a good thing to do, but I'm not scientifically certain quite how good they are. But I just have to follow the advice, really.
OK, well, let's go over to Alex now, who's been taking some questions from us in the Cube. Alex, what have you been hearing?
Well, absolutely, Tokes. We are, of course, live on Facebook, Twitter and YouTube. We're streaming. Please send your questions in. Just a couple have jumped out at me here. I mean, some of the questions, it's about this asymptomatic nature of this virus, of this infection, and we were just talking about it there. So should more focus, they're asking, be put on telling people, even if they're showing no symptoms, almost to act as if they were? Perhaps people should be in the mindset of, maybe I have this virus, as opposed to, I'm fine until I start feeling sick. So how should we treat this virus, even if we have no symptoms?
OK, well, Dr. Vaughan, that sounds like a question for you.
I absolutely. There cannot be too much respect, in one way, given to taking advice that is means you're being very careful. We've all been told here in the UK that we should be staying at home. We should be considering looking for symptoms, but absolutely we have to treat each other and socially distance so it's appropriate and is responsible, so that when you go out shopping, even if you're not displaying symptoms, that you separate at least 6 feet, and that you assume that anyone you could meet could have it, even though they're not obviously affected. And that you obey those rules. I would like to add one thing, though, because this is a very important caveat. I am worried here in the UK that we've seen a significant drop-off in the number of people actually going to hospital with important conditions that they would normally go to hospital with. And what we don't want to have is people staying at home with serious things wrong with them because they're scared of going into hospital. We are here to treat people, obviously, with COVID-19, but we are also here for people who are suffering from all the major problems that they would normally come into hospital for. So we are very worried about that. And the other thing I'd like to say is, if you do have symptoms and you do start displaying what we call more red flags, like you becoming breathless, your fever returns, having got initially better, you start getting nasty abdominal pain, please don't just suffer in silence. There is often a second phase to this virus that can occur 5 to 7 days afterwards, and paradoxically people can sometimes feel better and then get worse very quickly. Please think about seeking medical help, especially if you become breathless.
Well, that's a very important message that you've just put across there, that it's not obviously quite business as usual, but people who do have extreme needs have been urged to come forward. Samantha Rakati-Joyce, let me turn to you now in these unusual times. I've got a question from my own here, from Jack here in Lyon, who says, are you comfortable with the new methods of teaching that's really been forced upon you?
Comfortable. We're learning to be comfortable. It was difficult to start with. I think now, we're 3 weeks into confinement, so we're starting to get a bit more used to what we're doing. But it has been a very big learning process the past couple of weeks, because our whole teaching practices have had to be changed. We've had to get used to preparing lessons to give to pupils to try and help them, to guide them through new notions that they're learning, but without actually having any feedback at all whatsoever from pupils, which is very, very hard. I wouldn't say we're comfortable with it, but we're trying to do it as well as we can, as well as we possibly can, by integrating parents as well, and trying to help, as I say, guide the pupils through what they're learning as easily as possible. But it's not easy, and it's not easy for a lot of them because they're on their own. They're not in a classroom situation. They haven't got the help of the teacher, and they haven't got the help of their friends in class, and it's quite tough for them. So, no, comfortable not yet, but we're working on it.
Well, a struggle all round in that deafening silence, not only on the streets for those of us who are leaving the home, but also there in the classroom. Well, let's get some more questions now. Alex in the Cube has some more for us.
Well, I think this is one really talks for all three of our guests, and this is an interesting point, because even if you yourself are self-isolating, you might be sharing a house with your family, friends, partner. So what happens if they're going out and coming back in? This is a question I've been talking to Asma on Twitter. She's saying that while her brother isn't a healthcare professional, she's a bit concerned that maybe when he's going out and coming back in, he's not really being careful enough. So the question really is, what should you do if members of your household are, say, going to the shops, bringing back packets and this kind of thing, when people return? Do we need almost a disinfection station at the front? How should we react to that? I think one really for all three of you two to have a go at.
OK, well, why don't we put that question firstly to you, Lisa Forte. What's your thoughts on that?
I mean, I have no science to back this up. I'm not a doctor or a virologist or anything like that. But I've sort of been disinfecting food packets and things like that. I wasn't really sure how long it could survive. And I was thinking, well, actually, if someone who is infected goes to the store and touches, I don't know, a packet of tomatoes, and then I go and pick that same packet up, could I get it? So I've been disinfecting it. I don't know how useful that's actually been, whether that's actually making a difference. But, you know, it makes me feel like I'm doing something, I suppose.
Turning to you now, Dr. Vaughan, what can we make of all these? Because there's been a plethora of false rumours, and so many people do different things. You know, they get their shopping, some leave it outside in the sun for 2 or 3 hours. What are we to make of some of these claims and allegations that are coming across?
Well, I think one has to, you know, you have to try and balance what you can with your lifestyle without going completely mad. Do you know what I mean? You know, all of us have a tolerance for this, because being on lockdown has its own challenges. What I would say is the virus can last up to 72 hours on surfaces. However, that isn't the main route. The main route is clearly by droplets spread. So if someone was going out of the house to a normal job and then coming back, my advice to them actually is when they come in the house they could do things like change their clothes, have a shower, change their shoes. OK, that would be very sensible advice to give. If they were just nipping in and out, then actually let's not forget the very simple regime of washing your hands. Really washing them carefully, 20 seconds, and here in the UK, it's to the tune of Happy Birthday, doing a really good job on that. But thinking to yourself, actually, if you could have been exposed, especially my husband is a surgeon, he's going in and out to the healthcare environment every day. He comes in and literally bags his clothes, jumps in the shower, and washes his hands before he does anything in the house. And I think that's very sensible. But do not forget hand washing as a very simple, basic thing that you should do before you do anything or interact with anybody in the house.
Well, stay with us on the programme. We'll have more of your questions after the break. Many of them coming in. Do use the hashtag Euronews Answers and we'll pick them up. That's just in a few moments.
Tonight on Euronews.
Of course, I think it's important to remind to everyone that not one single country on the planet has been prepared, fully prepared for this kind of crisis. No one.
Thierry Breton, EU Commissioner for the Internal Market, is our guest on the Global Conversation. That's on Euronews and Euronews.com.
Est sorti le tout premier iPhone. 2006. 2007. 2007. Bravo. Christine, je vois pas. Qui a réalisé Kill Bill? Qui a dit Camille Combal déjà? 81 moins 5. 76. Ici. On se donne un bateau à 3 côtes. C'est une victoire très nette des pères ce soir. On les applaudit très très fort.
Welcome back to this very special edition of Euronews, taking your questions on the COVID-19 pandemic. Now, of course, you can send those in at any point using the hashtag Euronews Answers. We're streaming live right the way across social media. But I just want to draw out something, if I might, and that is the warning we're seeing from international policing bodies right the way across the European Union and, of course, around the world about criminals, crooks, people wanting to make money out of this, and in many cases putting lives at risk. Have a look at this from Interpol. Warning of fake masks, fake hand sanitizer, often sold online at inflated prices. Warning people against taking medicines. If we go here to the EU Medicines Agency, they're saying do not buy medicines claiming to be a cure for COVID-19 from unauthorized and unregistered vendors online. Clearly, there's a real concern here that people are looking to cash in. Then it's not just online that people are being warned. If you had a look at Action Fraud, it's a police body in the UK, they're saying, watch out for people pretending to be the police. This has also been a warning in France. People pretending to be government officials or police officers trying to take people to cash points to get their money. Of course, a lot of very vulnerable people, particularly isolated at this time. Then there's obviously the warning about general cybersecurity. If I can run you through a couple of key points about some of the main points to stay safe online. Warnings about out-of-date software, leaving you vulnerable to malware. Once again, a call to strengthen your passwords to stop people getting access to your accounts. Questioning the source, particularly online stores of products. And finally, if somebody's putting you under pressure, maybe on the phone, a telephone scam, to watch out for it. Now, that's some of the key warnings distilled from Interpol. You can see the full list, that's the International Policing Organization, on their website. But I might just go over to Lisa Forte, who's joining us. She is a cybersecurity expert. I think she might be able to give us a bit more of a sense. Hello to you, Lisa. Could you give us a sense, we've heard a bit there from Interpol, about what we can do without, becoming paranoid to keep ourselves safe from scammers, particularly online?
Yeah, so it's a real opportunity, unfortunately, for organised crime groups, people who perpetrate these sorts of things. And just recently, actually, in the Europol report, they said that elderly people were being called up, and the scammers would say on the phone to them, your relative is in hospital and they're suffering from the COVID-19 virus. They're on intensive care, they're on a ventilator, they're very seriously ill, but we can't give them any of the life-saving drugs without you paying their hospital bill. And what they were seeing was actually a lot of elderly people were so worried about this that they were paying this imaginary hospital bill on the telephone and being exploited. And it's that fear and anxiety that we all have as a society that's really owing itself here to being exploited by criminals, unfortunately.
Let me turn over to you now, Samantha Riccardi-Joyce, because that issue of online security also greatly affects our children, doesn't it? And, with so many of them at home, they're not, of course, all studying. They're much more vulnerable to perhaps being exploited by online scammers.
Absolutely, but the problem is for our teaching content, we're using obviously internet completely at the moment. So kids are being left in front of screens all day because they're having to be in contact with their schools for the work, and so they're obviously open for being attacked and being targeted by people with obviously not good intentions. So it's a problem. It's complicated. Parents have to be a lot more. Have to survey a lot more and keep an eye on what's going on a lot more. But it is very difficult.
OK. Well, let me just bring you now a question that we received here at our headquarters here in Lyon. Don't forget our hashtag is hashtag Euronews Answers. A question from Novita Ekasari via Facebook. And this is perhaps one for you, Dr. Vaughan. Once you've had COVID-19 and recovered, can you get it again? Is COVID-19 acting like any other virus?
Well, the answer to that is we actually don't know. This is a new virus, okay, for us. We obviously know about the coronavirus family, but actually the answer to that is we do not know. we're trying to, at the moment, the vast majority of testing carried out in the United Kingdom is antigen testing, and we are still waiting for the antibody tests to come online, and that will tell us more about who has had the infection. And then if we get widespread testing as that, we would then hope to study on a population basis how people then do. So I think the answer to that question is we absolutely, at the moment, it's hard to give a right answer to that. Apart from the fact that the safe answer has to be, because we don't know, you can't then assume that you can just go back to your normal lifestyle and not observe all the things that we've been advised to do so far, which is social distancing. If you're somebody with pre-existing conditions, or you're living with someone with pre-existing conditions, that you must act extremely carefully and responsibly towards them. And, we have to obey all the guidelines that we've been given to date.
OK. Let me ask you another question now. This one from Sexy Marmalade via Instagram. Which diseases and pre-existing conditions might place you in the high-risk group?
Well, what we've got to remember is that this virus predominantly affects the respiratory system, our breathing system. So anyone with asthma, another variant of asthma, chronic obstructive pulmonary disease, anyone who might be immunosuppressed, so anyone who's had a transplant. But the biggest single factor seems to be as to how well you do is actually age. So anyone over the age of 70 must also take this extremely seriously. But don't forget that it also can affect younger people. Tragically, we also lost a child aged 13 in the UK. But we are seeing in our hospitals people in their 40s to 50s and younger. But it is age that where people, if they get it and they're a part of the 10% that end up being hospitalised, they seem to be do worse than most if you look at the figures. So those risk factors, diabetes, heart disease, and also if you're overweight, that is also a risk factor. But predominantly it's the respiratory diseases, the asthma, as well as diabetes, organ transplant, anyone who's been immunosuppressed, anyone who's undergone chemotherapy. I'm a cancer sufferer myself. I understand about this. I'm now in remission. But anyone who's actually got cancer and is undergoing chemotherapy, it's really, really important that you are shielded and you do not go out for 3 months. And you try and avoid any exposure to this virus because your defences are down.
Thank you for that message there, Dr. Vaughan. Well, let me just remind our viewers, of course, that you're watching a special edition of Euronews now. If you have any questions, you can send them in to us because we're taking them here live at #EuronewsAnswers. Alex, have you got some more for us?
Well, absolutely, Tokes. We've been looking at all the live streams and your questions. And I think if I could just broadly group them, of course, we are, time isn't always on our side. So here we go. If I broadly group them, a lot of people questioning about blood in this, particularly if you've given blood or going about the normal activity of giving blood. Maybe that's one for Dr. Vaughan there. And just if I might also sum up some of the other questions about what the world's going to look like when this virus passes by. Susanna asking, will our societies be as badly hit as they were after the 2008 banking crisis? Now, of course, that's a very specific question, but there is a question here, isn't it, where people are talking about re-examining their values. So maybe I might ask our other two guests if they think societies will be changed. But if I start with Dr. Vaughan by asking about blood, is there a risk for people seeking to give blood?
Oh, can I just say, at the moment, I'm not aware of that specific blood transfusion guidelines have changed, all right? Certainly, if you have been infected by this virus or you are symptomatic of it, that you should certainly not be giving blood. If you've been healthy, okay, and you have not known to be affected, and you're still giving blood at the moment, then that's something that you should take up when you go to the transfusion centre and follow the most recent guidelines. Because we at the moment don't have widespread antibody testing, it's a difficult one to answer. But certainly, if you've been symptomatic or you have been near someone who's been symptomatic, I wouldn't advise that you actively give blood at the moment.
Now, we don't have much time left, but let me just ask a question to all of you, because so many of us, if we can look beyond this confinement, are wondering what the world is going to look like when we emerge from this lockdown. How do you see it affecting all of your industries? If I could start with you, Samantha Giacatiro.
Well, definitely in terms of teaching or in schools, things will change. Our relationships are changing a lot at the moment with parents, with the pupils as well, because obviously we're communicating through the internet. A lot of parents have been in contact with us because they have many questions about their day-to-day organizing. But we've been able to find a way of communicating together, which is very different from in the past. Parents are also explaining to us how much they realize that, well, they're beginning to understand how complicated our job is as well. So I think it's actually going to help us all to understand each other a lot better in terms of how we go about educating children and how we can work together, parents and teachers, to get where we need to go, really.
Lisa Forte, over to you. Do you see the world being a safer place online in a few months' time, perhaps?
I'm not so sure about that, to be honest. Just sort of looking at the situation now, cyber criminals have been very active. Certainly things like hospitals, for example, have been targeted a lot because they don't have the ability to have their systems offline for 2 weeks or whatever it takes. And I think the thing is that ultimately we're still online. People have gone and worked from home, which creates more vulnerabilities. And I think the issue really from cybersecurity is more what happens economically. And businesses will have a lot on their plates, no doubt, post-pandemic. And so the danger is that cybersecurity gets knocked down that priority list. And that's going to be a very grave error, I think, for a lot of businesses.
Lisa Forte, cybersecurity expert, joining us from Bristol. Thank you. As well as you, Samantha Riccardi-Joyce, joining us here from Lyon. And finally, a thank you to you, Dr. Jenny Vaughan, from the Doctors Association in the UK. That's all we have time for.
Can I just say one other thing? Possible.
I'm afraid we've run out of time, Dr. Vaughan. Yep, OK, but go for it.
That's all right. Oh, I just don't want to stop people, encourage people donating blood, please. People still need to donate blood. They just need to take regular advice. What we can't do is run out of blood at this particular time. And most people agree that if you are stable after 14 days, you should be safe, but apply for local guidelines. But please don't stop going to give blood. All the safety will be observed at the centres. We mustn't stop blood supplies coming in. I did want to add that. That's very important.
Thank you very much for that, Dr. Vaughan, for having that final message for us. Thank you again for joining us here on the programme for this special edition of Euronews tonight. Euronews Now. We hope we've answered some of your questions. Do stay safe and stay at home.